You're watching HCAM TV.
Hello, Hopkinton, and welcome to the Thursday edition of the Hopkinton Hangout Hour. Today it's August 20th, and being Thursday, we are so fortunate to have with us from the Board of Health, Shaun McAuliffe and Kasey Mauro, and with me today, helping me along is Jim. Will be co-hosting, and Bob and Matt in the background doing all the stuff, keeping us on TV and on
Did
YouTube.
you almost forget my name? Just wondering.
No, I had a little hiccup go on. I was a little stuck. How can I forget your name? Stop it. I mean, after we called each other and say, hey, let's wear the same shirt.
I know.
Shaun, how come you didn't get my email about wearing the same shirt? What's up?
I know. I told him he should wear a black tank top today. He didn't wear it.
Yeah. It's.
You know what? I think we're all pretty grateful for that, to be honest.
Yeah.
Kasey,
I'm not as spelt as I used to be.
Kasey, it's nice they let you turn the lights on in the hallway today. That was nice.
Yeah, I mean, to be honest, somebody did it before I came here. I was trying to figure out. I don't even know where they are.
They might have come on when the alarm comes on. The lights turn on, so that they might shut off by themselves on you. All right, so we got a whole bunch of new stuff going on that we need to know and need clarification. We got tons of questions since school is like the big thing that's going on and everything. But the one I'm going to throw out there, and here's the first curveball. My kid needs a flu shot to go to school. Why?
Your kid
What, the flu's still here?
Before December 31st. So
Okay, so
so it's not like this race, like everybody let's run and go get one. It's before the 31st.
Okay, so the flu is still here. We still have other diseases, right? It's not just COVID?
Yep.
Because I haven't heard anything in the news about people with the flu.
A bunch of birds died in Boston from botulism. So there's other things to worry about.
Right.
There's
a plague, the squirrel plague.
Listen, I just saw a couple murder hornets out on my porch, and I'm getting all nervous here. Everything's it's coming on. All right.
At this point, we expect anything.
So people should still be worried about influenza.
Yeah. Yes. Always.
Always.
Yeah.
So
we're not gonna we're always gonna recommend that you should get a flu shot and that you should take proper precautions to prevent the flu, common respiratory diseases, illnesses, norovirus. That's not changing. So in an ideal situation, if everybody is following the precautions that we have in place for COVID, we should actually have a better outcomes for flu season. We should see less people with
less
cold.
cases.
Yeah. And
so everything we're doing now for COVID helps. Why do we need to get a flu shot?
You want to? Oh, okay. So.
Well, no. Listen, I know the answer. I get mine. Casey already knows I signed up.
COVID and the flu are very similar, right? They're going to present with similar things: a fever, body aches, chills, nausea, vomiting, diarrhea. They're going to present with very similar symptoms. So if we know that children have been vaccinated for that, then we can not automatically assume that they don't have flu, but we can, with good judgment, think that that they're protected to some extent for the flu. In addition to that, let's say, we had like a regular flu season where people are hospitalized anyway for the flu. If you have a larger number of people that are vaccinated, then hopefully those hospitalizations due to COVID or due to the flu will be less, so we can still manage COVID and flu at the same time.
Okay.
And then there should be a reduced incidence of flu, which could confound, what's going on with a sick child in the household. And it'll just make, because one of the issues that we were facing last year was that we had people that had the flu that were initially quarantined. We had that one case that had they had both the flu and COVID. So um, if we're reducing the number of flu cases in town, it's just going to help us do our job. Yeah, it's just going to make our job a little easier.
All right. So let's take COVID out of the picture, and let's really talk influenza. I mean, this is something that we know how to battle. We know that getting your vaccine, it does help, and that the vaccine changes every year or sometimes twice in the year as influenza. Help me out with the words, guys. But the flu is not the same every year. It changes.
So when they do make a vaccine, right, they usually pick strains of influenza to put in the vaccine. So, and it's the assuming that that is the strain that is going to come up in this year. So they'll use that strain. And there's different ones. There's H1N1, flu A, flu B. Like there's a ton of different strains that they will add to the vaccine to hopefully combat those numbers. Sometimes it's more successful and they get it better. Sometimes it's less successful and they don't choose the right strain, but it still offers value. Like it's still worth getting the vaccine.
And different strains tend to present themselves during different times of the year. Last year, I believe it was flipped, where B came first and then A wasn't as, I think, right? Isn't that how it was?
Like we had a lot of flu. First, we had a lot of flu A, and then like in this late spring, we started to see a lot more flu B.
Flu B, yeah.
But when the results go to us in Maven, which is like the state database, we only get results that were done by like a verified laboratory. So like if you do like a CLIA wave test or like a rapid flu, we don't get those results.
So the question I have about the flu strains, I know they're kind of taking their best guess at what they think are going to be prevalent, and they're putting those into the mix. And then at some point, they're able to respond and say, oh, we did a good job, or there are other things that came up. And I'm just wondering, when will we actually know that?
I mean, as far as I know, and this is all new to me, like they pick the strains, they create the vaccines, they manufacture them, they give them out for the flu season, and they see how the year goes. Like as far as I know, they're not able to in the middle of the year decide to go with another strain and manufacture those doses and like restart the program all over again, like say in January. So it's kind of like a year by year basis where they evaluate how well the flu vaccine worked.
And I mean, there's research underway right now in Boston and Cambridge on how to develop a strain that basically a universal strain. They're still a few years away in having that brought to market, but that research is underway.
All right. So what are you doing about the flu? You got something going on that's going to help us fight the flu, Kasey?
Yeah. So we're going to be doing a number of flu clinics. I'm hoping to do one at the end of September and then do a few in October and kind of see where we are from there. Initially, this is our first flu season, so it's all new to us.
Just like everything you've done this year, everything
else, but I feel like in the past, like we have done flu clinics. We partnered with AFC, and they did flu clinics mostly for the senior center, and they had one at St. John's Church and stuff. But this is going to be different. This will be a drive-through clinic. I just put that survey out today on Facebook to kind of gauge people's interest on who will be using the clinic. Like, are we expecting to see only seniors? Do I need to order vaccinations for children as well? Like, are people going to be looking for specific types of vaccinations? Are they like for the intranasal one? Are they going to need preservative free? And then preparing all of that to make sure that we can handle a mobile flu clinic in a drive-through setup and to meet all the CDC standards that require, pre-registration, appointments, and contactless delivery of service, and proper PPE when like you do have to vaccinate a person. And so kind of learning the demographics of who's going to be using this are helpful, because say if we actually are going to be using the clinic for children, or I wasn't really anticipating that, like I'm going to have to plan for parents to drive through but possibly stop like park in a parking spot and have the nurse go over and administer the vaccine like when they're parked. Children are scared of vaccines, so it might take a little bit longer than like just a regular adult driving through getting a vaccine, and it takes 30 seconds. So
Right.
it just helps me plan.
Sure. And for the folks at home, if you're not on Facebook or anything, I did share it in all the Hopkinton groups today. Kasey, after you put it out, and I did make a link on our HCAM page. You just have to click here, and it'll take you right to your survey, and give Kasey some answers so she can best provide services for our town. So thank you for doing that. And so you're talking definitely more than one clinic.
Yeah, there'll be multiple clinics. I specifically was in my mind had already planned that there would be a senior only clinic. We had to pre-order vaccinations back in March, and knowing that I was going to have a flu clinic anyway, I had ordered, I think, 60 doses of high dose flu, knowing that was something specifically the seniors were looking for in the last year that was harder to come by. And then now just gauging like general interest, I can order more vaccines through the state.
Excellent. All right. So moving on. So again, with the mandatory kids needing it now to get it, what kind of pushbacks do you get that people that don't want to vaccinate for the flu, that don't believe in the flu shot because people got ill from getting the flu shots before? I mean, is there going to be a way? Does that parent have to have their kid vaccinated?
If they're in school.
If they're in school, they have to. There's no.
There's a series of exceptions. If they have an allergy, if they have a religious exemption, if they're being homeschooled. I think there are a couple others, but the expectation is that you're going to have your child vaccinated, and this gets to this whole, if we're really working together as a community to improve our health, getting the flu vaccine and reducing the flu load in the community is our target. Like, our goal is to reduce the rate of illness in the community. So this is one of the tools that we can bring to help achieve that objective. So
well, I think what I'd be interested in is actually what Mike was talking about. There are people who don't believe in the flu shot, and by requiring it in order to have your kids in school, I mean, do you anticipate that some people are going to be, shall we say, calling you up and discussing the finer points of that?
It probably will come up. I mean, but this isn't anything new. I mean, children have to get vaccinated to attend school. So, all we're trying to do is reduce the rate of another illness in the school setting. And and this is the stuff that, again, we've been talking about things that drive me bonkers. It's if we're following these practices, if we were following these practices better, last year, we would have had a lower incidence of norovirus. We would have had a lower incidence of childhood flu in the town. We would have had a lower incidence of upper respiratory illness. And we had some significant counts last year. And so I guess my question is, why would you not want to protect your child? And I would also argue that the majority of us, at least of my age, Kasey's very young, but we I had to get all my shots to go to school, and I would argue that for the most part, I turned out fine. It's this, and the vaccines that are available now are actually safer, but that's a whole other argument. And
Yeah.
I, you know, at the end of the day, what we're trying to do is, set up the community um, to be as healthy and safe as possible. And
And I,
that,
Shaun, I wasn't even trying to talk about the anti-vaxxers. I'm talking about the people that are just against the flu shot, period, which are totally different.
oh yeah,
I know that the anti-vaxxers, I mean, this is why polio's back again. I mean, we defeated that in what, the 60s, 50s, 60s?
no, there's a whole bunch of stuff that's coming back.
Yeah.
It's, I mean, I have friends who have got stuff that, you know, yeah, I mean, I just, and there's a lot of stuff that's coming back. I mean, I know people who've had anthrax, and really odd illnesses that, you thought were, you know, a thing of the past. And again, it's, at the end of the day, we're just trying to set up the school and the community for success.
Right.
And if we're protecting our kids and we're protecting our middle-aged adults, who's going to benefit? All the seniors in town.
Absolutely.
And again, and it's the seniors that we were trying to be most protective of for COVID. And if, again, if we're all working together to reduce the incidence of flu this year, our seniors are going to be, benefiting on the back end. So.
All right. So again, yes, we're do our protections, protecting others from ourselves, not so much us, because by staying home, we're protecting ourselves.
Protecting you a little bit. So, I mean,
Yes, you do have a little, but the main goal is not to spread. Yeah. All right. So let's talk COVID cases in town. We get bombarded every day with all these numbers and charts and whatever. And I was just wondering if we could sort of explain the chart that I'm going to pop up now. What does this mean? Here we are, Hopkinton, and I'm seeing a nice low number like 136, and all this less than 5. Can you help explain this chart first?
It's out of date. It changed.
This is the August 19th. This one yesterday.
I know. It changed. We got a new case, but
well, will I see that one tomorrow on this chart?
it should have been. It should have been there. Yeah.
Yeah. But so this chart. So this is the numbers of that big chart and all the colors that you see of all the different surrounding towns. And so we remain an unshaded town. We have had 136 cases of COVID total. Right now, our current case count is less than 5. We have 2 active cases, and then they have the average daily per incidence rate. And so that's how you get your color. Yeah. And we are still in that safe range. Our case count is lower today than it was, or lower than it was before. And then it says like the total positive test dates, like Shaun was saying, it only says the 1. But we actually have 2 active cases right now. And then it just lists the total number of all people in Hopkinton that have been tested, which you can see, like that's a big number. So people are, there's a couple things. People are accessing testing, which is great. I hope that they're just accessing the testing and that there's not that many oopses in town, that many people are seeking testing. But overall, like, it's a good thing. All those numbers are a good thing.
Right. All right. So it's speaking of testing, I believe there's still some testing available here in right next door in Framingham over here. Is that still going on?
Yep. So the Stop the Spread initiative is still going on. It's going on until September 12th. And it is a drive-through format. I believe that right now they're doing NP swabs. I think originally they were doing saliva at some point. It's open to anybody. You don't have to be a resident of Framingham. You can be a resident of any town in Massachusetts. And from what I've heard, the wait times are about 2 hours. So you go in your car, but you wait about 2 hours, but the results are coming back most of the time within 48 hours.
Excellent.
And,
And I see they have walk-in at Amazing Things Art Center too, which is pretty neat.
and there were a couple residents that went in for, I believe, a Saturday. No, they went in for, it was a Friday afternoon testing, and they had their results by Saturday evening. So, there is that option. You could go to Marlboro, but there's a variety of other testing sites in the region. So, we have a considerable amount of options, and we have options in town. I mean, but Tri-Valley is set up as a testing facility at 1 Lumber Street, and so we have options. We're helping guide people. We've had people who have suspected that they had been exposed or possibly had picked it up somewhere, and so but they weren't available to sit out for 2 hours for at one of the free sites, so we were able to help direct them to other testing options. So we continue to work together to help people identify the best options, answer any questions they have, and we're encouraging people to get tested. I'm starting to go through the travel order documentation just to make sure that those that have said they were getting tested did in fact get tested, and just to make sure that that's all lining up the way it should be.
So where can we go without needing testing now? I mean, has that changed? Is it still New England?
You should stay home all the time.
No, it's still the same states. Nobody's dropped off since the last time we crossed Rhode Island off the list. It's still the same. So Maine, Vermont, New Hampshire, New Jersey, New York.
New York.
All right, just checking because I do have to head to Maine tomorrow to perform a wedding, so I'm just a little nervous about that.
And again, with respect to like I got a call today about someone had to travel to their vacation home that they had rented out to get it ready for the next family that was coming in. And I said, again, it's using common sense and making good decisions. And I know most people are like they've got decision fatigue, but when I walk this individual through it, he's like, well, there really isn't, this isn't anything that I needed to call you about. But I said, so you just go to your house, take care of the issues, wash the linens and whatever that you've got to take care of. If you're handling soiled linens, use a mask, gloves, use either a disinfectant or make sure that you're using high heat for the wash and the dry. Don't go and hang out with the people in the neighborhood, unless you're distanced and masked. And it's just practicing these same principles that we discuss, every week now. And then they were like, oh, well, I guess, that's really not difficult at all. And it's what we're trying to do is just remind people that you're empowered with all of the skills that you need to keep yourself healthy. And you just need to put these things into practice.
All right, so people behaving themselves, where you mentioned, and gathering. So we had to take basketball hoops down. What, any other extreme measures you had to go in town to people weren't behaving?
No, and
Good.
no, and we're evaluating, how to bring in what sports we can bring back. What we're trying to figure out what the fall and winter recreational sports and practice will look like in town. But at the end of the day, we there was an unchecked risk that that we wanted to make sure that was being addressed. And short of me sitting out there from 5 to 8, 9 o'clock every day, or us bringing on extra patrolmen during a shift, or it just wasn't feasible do it any other way. And I'll tell you, I got my fair share of calls, complaints, and what have you. But we're trying to figure out how we can bring this back. But more importantly, our main goal right now is to get the community set up so that we can get our children back to school, so that our residents can return to some set of normalcy in their work life, and that we can continue with our low positivity ratings.
How are the supplies going? How are people, everyone having any problems getting sanitizers, getting masks, getting gloves, any PPE with our town's first responders? Is everything's like, can you get toilet paper in the stores? Is it things getting almost back to that normal?
Yeah, I mean, I feel like with the exception of trying to find like Clorox wipes,
Yeah.
which you can still find, it just may not be at the first store that you stopped at. Most things are back to normal supplies. And as far as like PPE, the fire department has an abundant amount of PPE. They just got restocked by MEMA, and they have a really good number of PPE. And I just did fit testing with the nurses this morning and make sure they're all ready to start school, and that they have the proper PPE and supplies that they need. They've been using my medical provider at this time to order their supplies.
And I think we just lost Kasey.
Oh,
Oh, she's back again. There you are.
My internet is so bad out here.
Tell Mary to open the door and send some out the door for you. All right. So you said that everyone should be set. You just met the nurses, and you did fit testing with them, and make sure all their PPE was up to snuff. Are they installing? Do you get involved with the installation of like the plexiglasses and all those procedures? Is that how far down you go and help everybody?
we work with engineering and so we have our own town hall reentry group. So we review everything on a case by case basis, trying to help mitigate exposures in all of our municipal buildings. Some of it is a little overkill. Some of like the plexiglass is really just to provide just to put people at ease, and that's part of public health. It's just putting I look today and I keep on forgetting that we have plexiglass in front of our roll down grate, and do we need it there? Well, we don't hold in-house appointments at the town hall. We hold them at our record storage location. So we don't need it there. We're scheduling everything by appointment, and people that do make it up to the different offices, the expectation is that they'll have PPE, that they'll be standing on the queuing location right outside of the grate, so that we're providing 6 feet of separation. So if we simply were there having a discussion with our masks on and with distance, we wouldn't need any extra plexiglass. But again, it's just something that helps bring a little extra ease to people. And one of the things that's been discussed in at least the town hall building is we don't have a formal HVAC system. So, we don't have an optimal air circulation. So, I mean, having an extra plexiglass shield, might provide a little bit of extra benefit, but yes, we are involved with a lot of those decisions.
Right. So we had town clerk on yesterday, Connor Deegan, and we have the election coming up. I mean, the town meeting coming up first on September 12th.
Right.
And have you been involved in those preparations? Everything.
Yeah.
You haven't missed a beat, have you?
like I have this conversation with Norman all the time. He's like, your hands are everywhere. Like our department has, if you break it down, we have 100 and actually now with the pandemic, we probably have 187 duties that we're responsible for. So on any given day, we're involved in just about everything in town. And it's one of the reasons why the department is its own separate. We have our own separate board, and we operate kind of parallel to the municipal offices. But yeah, I mean, we walked the senior center. We figured out the best and safest pathways to provide residents access for early voting, and we wanted to make sure that those that were arriving at the senior center to early vote could do so without disrupting the meal program that we have for the seniors and any other activities that are going on at the other end of the senior center building. When it comes to town elections, we help with the spacing, engineering the airflow that the airflow in the building, how they queue in line, how they enter and exit the space. And the same is true for town meeting. It's what size of a tent, where the tent should be, how do we set up the queuing, how do we set up and locate, ideally you want to locate the speakers away from the residents that are listening. It's going through and making sure that all of these practices are compliant with the existing regulatory framework that has been established. So, and then with all the regulatory framework that's been established that changes on a day-to-day or a week-to-week basis, it's making sure that we're all looking at the most current set of regulations. So
normally we see you at every town meeting too, sitting in there with the rest of the department heads and so forth. And I'm sure you'll be at this one and not just sitting there, probably just checking things out, making sure everything's going.
And that's the kind of the odd thing about this whole process is that, so, yes, the health department is there providing guidance to make sure that everybody is operating and executing in accordance with, the governor's orders, the guidelines, the sector specific standards. But we're also the enforcement agency that, if they're not compliant, is supposed to, take action. So it's a unique, it's a really unique position because, we haven't had any issues where there's been a tension between the way that the town would like to operate versus, what the guidance documents required. So to that point, we've all been aligned, and it's been, it's been going off without a hitch.
Well, it's good to hear. So when it comes down to you mentioned early voting and so forth, will you also be taking part of it as far as the regular election day at the middle school? You'll be making sure all the systems are in place?
Yeah. I mean, I did a walkthrough of the, so I assisted with the local elections. I did a morning walkthrough with Connor and the team. I swung by, midpoint just to make sure that everything was, still operating properly and that there were no concerns. And then it's a good opportunity to sit down with, the seniors that are working the polls and the public safety that's there to address questions and concerns that they might have, related to the operations or how that might transition to, the town meeting. And because and that's one of the things that I think that is a bit frustrating with all of this, with all the COVID work that we have. We've in a way been kind of isolated from the general public, and actually that's one of the reasons why we're here with you, is because we have so much to do that we've really had to withdraw and just focus on all of our tasks, and it's important for us to get out and address the public's questions.
Right. So here's a question, because this is just happening as tonight. We are having our first live meeting of school committee members at the high school library tonight. Have you seen that layout? Were you part of that? I'm guessing no by the silence.
I haven't, they know what the guidance is.
Yeah.
So we provided the guidance, but
Okay.
that is one that I have not walked through.
I was just curious. Everything's set up. Everyone's distant. Even where I'm set up to film the event, I'll be away from everybody. I'll have my big box in front of me. No one's going to see my face. My arm might stick out to move a camera. That's about it. So now that I've gone over everything that I know of that's going on, what do I don't know? What do I need to know? Here's your chance to give us some guidance. Here's all, because I'm thankful that the town gives us all this information. Kasey, with the Facebook post, you with the press releases and the town, everything. There's lots and lots of information. That's why I'm so, I'm going to use the word smart, because Jim will start laughing. That's why I know all these questions to ask, because of what's going on. But what do I not know? Tell us something good.
Oh, I mean, one, it's something that, we're learning, week by week, is that, we have a population that has a lot of travel requirements for work. So in the last, 2 weeks, we've had 287 residents who have completed the travel order paperwork. So, that's a little eye-opening, that there's that much travel. So we're trying to figure out, how do we prioritize, reviews of that documentation. And, what we're going to start doing is just, so I guess at the end of the day, we have a subpopulation that is involved in a high-risk activity. So we want to make sure that they are taking all the precautions that they can, and especially those with, children or family in the school system, that they are being as cautious as they can when they're traveling. Because again, we don't want to, bring in or introduce COVID or anything else into the community. So it's really imperative that everybody that is involved in traveling, that they're taking precautions. The other thing is that, again, as we get ready to return to school, we want our parents, to start preparing their children for what school will look like, for those that are, going back in the hybrid format. We want them to be having discussions about, masks, finding out now if the child likes that mask, if it's too small, if it's too restrictive, if they're having troubles breathing through it, and sorting those issues out now. to start having discussions about monitoring their child's health, and for that matter, monitoring everybody in the household's health. Um, it doesn't appear that the CDC, well, the CDC hasn't yet required a formal attestation like you would have to do at work. But they are recommending that parents on a daily basis complete an evaluation of their child's health. Do they have a temperature? Are they exhibiting any of these symptoms? If they are, then the child should stay home. But we want people to start practicing this. We're happy to provide guidance, tools, or other information to help people prepare, because it's really parents assuming that responsibility and taking part in those communications that's going to help set the school up, because this is going to be such a new environment that the teachers, the school nurses, the administration, they're going to have their hands full. So anything that we can do at home to get our kids set up, and anything that we can do to reduce the potential to introduce illness into the school system is only going to help. It's going to help the school, but selfishly, if I'm a parent and I have people sending sick kids to school, that's going to jeopardize my work life. So it's important, like if we want continuity in our work life, we have to make sure that we're monitoring our children and keeping sick children home. um and if we're doing that, I think we're going to be in a much better position.
I would just tell people to expect things to change, like just be ready for them to change all the time. Like the information that they're trying to compile for the school reopening, which is the largest reopening of and gathering of people that we're really trying to put together in the state, all the information is going to change, probably day to day. In the morning, you might hear that kids are like the worst spreaders, and by the end of the night, they actually don't spread anything. And so the information is going to keep changing, and the best thing we can do as adults is just have a little bit of faith in that people that are guiding them to this reopening are trying to do it in their best interest. I would be potentially sending my kids to the same school that I'm trying to reopen, so I'm only gonna say that it should reopen as long as it has the right things in place. And me and Shaun know the things that help keep a place open and safe, even in the middle of a surge. So, it is possible to do it. But as parents getting ready to send our kids to school, we have to just be modeling best behavior and making sure that we are kind of setting the tone for that return. If we're scared and constantly reading information and believing the first thing that comes to us, kids are going to feel that anxiety and then reflect that. But if we are making sound decisions based off health metrics and using best practices, the kids will start to see like, oh, mom and dad are confident in this, and it's okay for me to be there, and they'll feel better about it, and they won't be nervous. And so, we really just have to be flexible and confident that we're going to get there together. It's going to require a lot of input, but we can get there.
So one thing that I am really interested in, the news really jumps to, oh, there's an outbreak here, and oh, there's a huge quarantine here. And we're seeing colleges that are talking about opening up, and then they decide to go. Worcester school system just decided to go, all remote. I think it was South Korea had been doing really well. All of a sudden, they're getting a bunch of cases. Massachusetts did really well bending that curve, and then there were some parties going on. I'm just curious if you're able to. I know that you are aware of media and news as well as official sources of information on what's going on. And I know what you're going to say. I understand. We just got to do what we got to do, right? We got to do masks. We got to do hand washing and sanitizing and physical distancing. I know, but are you able to talk at all about what your fears and expectations are as we go through this?
Like if you start looking at, problems that they're having in Ohio or at Notre Dame and, the school system in Georgia, like a lot of those schools are reopening basically in an environment like we had here in March and April. It's like it's hell. And and like honestly, I wouldn't want to try to even consider opening in that kind of environment. But we're not in that environment, and you know, we've worked to set Hopkinton up, um, you know, in I would argue one of the best positions that we could put them in, where we have low rates, low positivity rates. We have a considerable number of residents. What it's a quarter of our residents basically have gone in for testing. Like we've done our work, and so I don't have the fear, but to that point, I mean, you look at Holy Cross or Yukon, all it takes is a few knuckleheads to go and throw a kegger, and they have 100 kids um, at a party unmasked, drinking, not socially distancing. Um, you're at risk at spreading illness throughout the campus community. But on a positive note, you're looking at the numbers coming out of BU are really good. I mean, I think they're somewhere between seven. The last numbers I saw were 7 to 11 positive cases out of over 6,000 kids being tested. Um, so it can be successful. It's what is the environment that this like community or the state environment that they're opening within, and um, and then how are we working with what are you communicating to the population, and and one of the things that we're trying to work on right now is getting that communication out, and working with parents, educating all of the people, and we're trying to figure out how can we provide that educational experience um, to the teachers, so we kind of create this like this muscle memory so that they can execute um, their day-to-day routines properly. And this is all, as Kasey and I were discussing today. I mean, it's never been done before. So we're trying to figure out, on top of everything else we're doing and all of our other responsibilities, like this is something that we need to work on to help get everybody again into a much better, more comfortable and confident position.
Parents can set themselves up like how will I consider school successful? So school being successful doesn't mean that there isn't a case of COVID in schools, because we're not gonna be able to eradicate it. It's still going to exist, but success would mean that it doesn't spread. So if you prepare yourself that there potentially might be a case, your child might be quarantined at some point, but it didn't spread to anyone in the class, that is success, because we would have been successful in either not allowing that person to come to school while they were in their infectious period. We would hold people out if they were symptomatic. We would be doing the social distancing, mask wearing, cleaning to prevent the spread of it. So if people go in with the expectation that there's not going to be any cases of COVID, like that's not realistic. You have to be willing to accept that there are still going to be cases of COVID within the town of Hopkinton, and that children could possibly be quarantined, but successfully measured by whether or not there's community spread. So if there's no transmission, that is success.
And you look at what Kasey and representatives from the fire department did this week. They were down at Golden Pond reviewing, how to select proper PPE, how to institute better infection control. Because just like, opening the schools, as we move into cold and flu season, we're trying to set up, our assisted living and our elderly communities as best we can to, prevent spread within those environments. And it's education, it's communicating, it's setting expectations, and making sure that people are, prepared. And then, and I would argue that we're, for the two of us, I mean, like, we're doing a pretty good job at getting out there and working with people.
We know how to do it. We know
Yeah.
we know how to do it. So I mean, and it wouldn't be the first time that we've done it, or set up a plan. And we do have a really awesome community that that listens, that does the work, that wears a mask, that stays updated on Facebook and is interested in participating in a flu clinic and even volunteering for the flu clinic. Like, we live in an awesome town that is willing to do the work, and we have awesome staff within the town and the schools that have the best interests of kids and teachers in mind, and we can do it. We can do it. We just have to go in with the right mindset.
Okay.
We have to own it.
Real quickly, Shaun, on something that you said, that this has never happened before. And I think we've all heard about the pandemic of 1918. So I'm curious to know if there are lessons that you have studied and learned from that, or if this is really building things up from zero.
No, I mean, and there are lessons to be learned, and I've gone in and looked at, and it's funny you brought that up, because when I studied for my sanitarian license, I couldn't get the current textbooks that I was dirt poor, and the textbook I needed was like $800. So I used all the textbooks from the early 1900s to the 1950s, figured out what public health law was then, and then how to adapt that. So just that experience helped set kind of me up thinking. I mean, because they again, a lot of what they did in 1918 is no different than what we're doing now. It's
Exactly.
distancing, it's masks, it's improving your hygiene, it's quarantining people. Granted, we're not sending people off to an island, but or to a quarantine farm or hospital, but we're implementing the same types of activities while we're waiting for vaccines to be developed. So it's really not that much different, and then it's not difficult. It's and that's the thing that don't fight me on the mask. It's like this simple stuff, if it's implemented, I think we've demonstrated as a community that just with a majority of people complying, we have been able to drive our positivity rates down to 0.13. It might rise up to about 0.35, but still, we have one of the we're enjoying a lot of success that a lot of other communities are not, and we we had a rough go at the start with all of the Biogen employees and some of the other spread, and then with Golden Pond. But we've demonstrated that when we all kind of aligned and all started working together, we were able to recover from that, and we've done well. And that's all we're asking everybody to do, as we move into the school season.
So I was talking to somebody yesterday, and they said something that really caught my attention. They just kind of said offhandedly, you know what? I don't think we are ever going to go back to normal. And I was like, oh, I can't even conceptualize that. I'm just really waiting for a vaccine. But what do you guys think? Do you think we'll ever go back to the before times, or do you think that this is going to really change our style of life?
I think it'll change some people, but it won't change everybody. Just like right now, like we're in the middle of it. It's not going to change um, everybody. I feel like we'll have more awareness of the things that we're missing in COVID. You know, I think that there definitely could have been a lot more assistance with nursing homes and assisted livings, like making sure that they had like the annual education and just like, you know, just like that support that they really needed. And I think that we'll probably all wash our hands a little bit more than before. So I guess that won't be normal, but I'm sure some people will go right back to it.
But you know, we didn't have norovirus, and like, and we're actually in what are probably, we've had, I think, 3 versions of norovirus have spread through North America. We're all praying that we don't get, I think it's the Australian version that we're not, our bodies just aren't prepared to adapt to. But you know, we've learned just again by good hygiene and good practices during the flu season how to manage, you know, norovirus. So again, like Kasey said, it's just going to require a little more, you know, responsibility and attention to our health and hygiene. But again, if we just, we're all implementing these practices, these best practices, we should be fine.
All right, Shaun, we have just about 3 minutes left, and I got an email, a couple questions. Who is actually overseeing school-related or sponsored sports? Who oversees that safety? Like, how are we ensuring protocols being followed both on and off the field?
So the state provides the guidance. We review the guidance with the different teams, and then yeah, and then
Not school sports. So like if
not school sports.
yeah, so like schools and the health department are separate. So like schools do school stuff, health department does health department. We can share information, but like we don't get to say like this is what school's gonna do, and school doesn't get to say that like they're gonna do something for like the health department. They don't all of a sudden get to talk about wells, you know.
Right.
So if it's a school sport, that they receive guidance from us and information, but it's on the schools.
Right. You're not watching. You're not going to every ball game. You're not going. You already did your job. You provided the information, and it's up to them to keep it going. Just like it is every restaurant owner, store owner, or citizen. Okay. Next question is, why is it okay for 100 kids to eat lunch unmasked together in the high school gym? Any thoughts about, or did they consider? Well, that's a more school committee question. If they consider no lunch and shortening the day.
It's not going to be 100. I actually got that. It might be 80, but they're going to be properly distanced with improved ventilation. But again, and this gets back to a lot of the questions that we've been addressing with, you know, the teachers and just people in general. Like, if sick kids aren't going to school, if the teachers, the staff, the administration are staying home when they're sick, we should have little to no illness in the school to start with. And then if we're distanced, if we've washed our hands or sanitized our hands before sitting down, if we have the new filters, the ventilation, you should be fine in that environment. And we, you know, to some extent, you all survived, you know, local elections. You know, we had people going through local elections, and what we did was we played a little game with the floor air dryers to circulate the air, and and that's what we're going to be doing here. It's just
great.
Yeah.
All right, Shaun, Kasey, thank you very much for your time. I can't wait to see what next week brings. I'm saying, well, you know, there wasn't that much new stuff. How are we going to get an hour out of this? But yeah, obviously there was enough to do that. So thank you again. We'll see you next week. And everyone at home, tune in tomorrow at 2 o'clock with Tom Nappy. brings us the sports update, how the Ashland Sevens and the Hopkinton Senior Youth team's done, and show you some highlights from that. So, Jim, thank you very much, and everyone behind the scenes, have a great day.
Thank you.